Good morning from Denver for ARVO 2026. My name is Dimitra Skondra, and I'm a professor of ophthalmology at NYU Langone Health, and also the vice chair of ophthalmology at the NYU Graduate School of Medicine and NYU Langone Health. We had a wonderful mini symposium yesterday about the links between systemic diseases and ocular diseases, and my talk was about the connection between the nutrition and retina health, in particularly in the context of the diet-gut-retina axis and macular degeneration. So we basically made a review about how the field and the AMD paradigm has been shifting from focusing just on the biology and what's going on in the eye, in lifestyle and how the lifestyle choices of patients can affect the risk to develop AMD and also to progress and lose vision. And interesting that the field has only been emerging for the last 10 years, that not only data show that diet affects the risk for progression, but it seems that the gut microbiome seems to mediate in these effects of the diet on AMD, age-related macular degeneration progression. And in particular, we covered work from different groups that be studying this topic, either high-fat diets or high-sugar diets. And my group studies a more kind of like real-world diet that is both increased saturated fats but also enriched in sucrose. And we all kind of seeing kind of the same, interestingly, same diversion that the microbiome seems to mediate in these effects. And in particular, specific microbes classes seems to emerge and to be connecting between the links. We focused a big part of our work to actually see if the changes we're seeing are important in driving the disease or just like a byproduct of the diet. And we used very sophisticated models we developed in my group to show that actually the gut microbiome has a causative relationship between the diet and the AMD features. And basically that it mediates the effects of the diet. But not only about the bad stuff, but also we look at that healthy diets, so like Mediterranean type of diets, that have been shown in epidemiological studies to decrease the risk of progression, also seem to be working through the gut microbiome. And not only about who is there, but more importantly, how the microbiome does it and how they function. And we've identified some very powerful small metabolites that are only gut-derived that seems to be both in animal models and also from patients really correlate with the AMD progression risk and severity. So we're very excited about this new era of not only thinking the AMD in the lens of the eye, but also in the lens of upstream drivers of the process from the gut and systemic inflammation that affects the eye. And I think I'm excited particularly for the option that is something we can do about. The gut microbiome is very dynamic, it's very modifiable. So not only can you have a dietary intervention, which is actually great, but even for those that maybe not be able to comply, we can develop very microbiome-focused interventions to really affect the course of the disease and stop the progression. I think we need to kind of talk about diet to our patients more, not just like a little bit of afterthought at the end of the meeting, the moment of they're meeting them. And because we are not nutritionists, I think we should like really discuss how important the diet is for the eye disease and encourage them to read or see nutritionists. And of course, maybe even provide some resources that we can provide with them at the eye clinic at the end of the visit to educate them. So education is key from different aspects, educating the new medical students and the new doctors about nutrition, which is something that is lacking in medical schools. Like I was not much about nutrition when I was in medical school. Incorporate this integrative approach in approaching patients in training. And also, in addition to talking about patients' diet, I think in the future we're definitely going to be using these pathways to modulate disease with new therapeutics.